Today, on behalf of World Leprosy Day, we are conducting a webinar to spread awareness about leprosy.
So, what is leprosy? It is a contagious disease that affects the skin, mucous membranes, and nerves, causing lumps on the skin. So, yearly there are over 1,20,000 cases of leprosy diagnosed. So, to learn more about leprosy and to learn its different attributes, we would like to call our guest, Mrs. Gauri Bhamre, ma'am, who has done M.Pharm in pharmaceutics from Pune University and has a wide knowledge and experience in teaching pharmacology and toxicology. Ma'am also has published two review articles and one research articles. She has also been a R&D associate with Godrej.
We are lucky to have such an exceptional teacher for this webinar. So, I now invite Gauri ma'am to start the webinar and enlighten us.
I now invite Gauri ma'am to start this webinar and enlighten us. Hello, ma'am. We can't hear you.
Am I audible to you now?
Yes, ma'am.
Yes, ma'am.
Thank you for reminding me. So, for the timing, I was saying that thank you. This is a very good opportunity, and I'm enlightened that I'm very happy to present this webinar on on this occasion that World World Health Day, Companion Day, World Leprosy Day. So it is a I'm thankful to you all students and the staff members that they choose me for this webinar and giving me this opportunity. So shall we start with the presentation now of webinar?
Yes, ma'am.
Yes, ma'am.
Okay. So we will have the introduction in brief first. See, leprosy, it is also known as the Hansen disease. The disease, it takes its name from the Greek word lepri, from scale, and lepsis means scale. So the leprosy is the disease which is related to the skin and the nerves, or we can say the central nervous system. While the term Hansen disease is named after the Norwegian physician Gerhard Arham Hansen, Amar Hansen. So it's a long-lasting or a long-term infection caused by the bacteria Mycobacterium lepri, or Mycobacterium lepromatosis. So this is the main cause, or we can say the agent is Mycobacterium lepri, or Mycobacterium lepromatosis. So this is the infection which can lead to the damage of the nerves, respiratory tract, skin, and the eyes. This nerve damage may result in the lack of ability to feel the pain, which can lead to the loss of parts of the person extremities from repeated injuries or infection due to unnoticed wounds. So this is the infection which is caused by the bacteria, and this is going to affect the nerves. Those are peripheral nerves. So in the peripheral nerve there are Schwann cells which are enclosed or which encloses the axon parts from the motor or sensory neurons. So by affecting those neurons, the cell neurons, the biological abilities are changes. The biological changes occurs, and this leads to the impropriate working or lead to desensation or uh, demyelination of the skin. These are the complex things which are occurred due to these nerve peripheral nerve damages, and this is caused by the bacteria or the agent which is the main cause of leprosy, which is the cause of leprosy. So in this way, the nerves, respiratory tract, uh, total skin over all over the body, and the eyes are affected. This damage the nerves, and which leads to the loss of the person's extremities like fingers, hands, or nose, like things which are affected and which are not working, or the defiguration occurs due to this leprosy. And this is the main cause. This is happening just due to the repeated injuries, means the injuries which are occurring at the same place repeatedly and not treated, or uh, we can say the unnoticed wounds where person just uh, just cannot understand that wound is happen, and this happens due to the nerve damages where the sensation uh, doesn't occur to the people that they are injured or not. So these unnoticed wounds are going to affect the nerves, and they may lose their um part of the body. And if these unnoticed wounds remains the same, the initial treatment or the further treatment is not possible, where leprosy is the thing which is cured by the initial treatment or the treatment in the initial stage. So the next point is, an if infected person may also experience the muscle weakness and the poor eyesight. So infected person will feel the muscle weakness as the nerves will not work properly, or the energy will not be provided to the muscles. The muscles will not work properly, so the muscle weakness and the eyesights will be hampered. The leprosy symptoms may begin within 1 year, but for some people, symptoms may take 20 years or more to occur. So, leprosy is the thing where infection occurs, or an infected person cannot be diagnosed earlier for the leprosy. The symptoms are not seen in this leprosy earlier. It could be seen earlier, or it might take a long period, like a 20 years or a lifelong period. So some persons which are infected in a childhood or in a mid-age, early age, have been seen or diagnosed for the leprosy in a late parts or the lately 50s or 60s. So this is the thing, that incubation period of the bacteria is longer and diagnosis is delayed. So next thing, why do we celebrate Leprosy Day? So today's webinar is conducted on the World Leprosy Day. So this international day is an opportunity to celebrate the people who have experienced the leprosy, raised awareness of the disease, and call for an end to leprosy related stigma and discrimination. As everyone knows, that leprosy is called as Kushtarog in Marathi and Sanskrit. I think everyone know how these peoples are treated. There is a stigma and discrimination about this disease. So The people who are social workers, doctors, and the educated peoples having a good mentality, we can say, those are aware of this leprosy causes, preventions, and the treatments. These people are working, or these people are spreading the awareness for this disease and trying to eliminate the stigma and discrimination about this disease. For this thing, the International Leprosy Day is celebrated. The World Leprosy Day is celebrated on the last Sunday of January. Worldwide, we can see that the Leprosy Day is celebrated on the last Sunday of January, but in India, we celebrate World Leprosy Day or the Leprosy Day on 30th January. In 2022, the World Leprosy Day is on 30th January, but in India, see, why leprosy on 30th January? Anyone knows?
Ma'am,
Yes?
can you please on the camera?
Okay, I'll just give me a minute. Mm, just a minute, I'll just see it. Is it okay?
Yes, ma'am.
Okay. See, in India, Anti-Leprosy Day is observed on 30 January every year. That is Mahatma Gandhi's Martyrdom's Day. Anyone know the reason? Am I audible to you people?
Yes, ma'am.
Okay. So, Mahatma Gandhi's Martyrdom Day is on the 30th January. So, in India, we celebrate the Leprosy Day on 30 January as Gandhi was deeply committed to the cause of leprosy. Am I going too fast? Is this speed is okay for you people?
Yes,
Yes,
ma'am.
ma'am.
Okay, okay. Agent. Agent means what is the cause of leprosy. The agent is Mycobacterium leprae. They are acid-fast bacilli and occur both as intracellular and extracellular bacilli. So these are the acid-fast bacilli. It means which are stained by acids. Everyone knows that acid-fast bacilli, which are very hard to stain, but once they get stained, the stain is not removed. Usually they occur in a the color is pink color. We can see the slides. On the slide, we can see these acid bacilli as a pink colored bacteria. So these are intracellular and extracellular bacilli. Everyone knows that intracellular and extracellular bacilli, those are those multiplies on the external side, and intracellular which multiplies in the inside the host cell, or any human cell or the animal cell, but inside the cell. So those are the intracellular bacilli. So Mycobacterium leprae is the intracellular as well as an extracellular bacilli. They occur characteristically in a clamp or the bundles of globuli. So this is the occurrence of Mycobacterium leprae. It occurs in the bundles or the globi. See, as many 2 to 7 billion may be present in a 1 gram of leproma. Leproma is a skin lesion where 2 to 7 billions bacteria are present in a 1 gram. So this is the main cause or agent for the leprosy. Next is uh, see, these are the images for the leprosy, how the leprosy looks like. So first image is given for the borderline lepromatous. So these are the types. You can just see the images right now. We will describe these types of leprosy afterwards further. So these are the images. In the first image, you can see the red patches or globules lesions. Like in the second, you can see the depigmented or hypopigmented skin. In the third image, you can see the lesions which are smaller in size and multiple in number. See, the another image is tubercular leprosy, which is on the face, and these are the other images from the different types of leprosy. Last image is lepromatous leprosy. Next, we will go for the symptoms. There is two ways leprosy is presented. The symptoms are divided in the two ways or according to their types. Mainly the symptoms for the tubercular leprosy are severe pain. So imagine you are having a nerve pain, or we can say having an injury, and how does it works or how does it hammers to your brain when a simple injury to your hands occurs. So these are the injuries on the skin, so they causes the severe pain. In the tubercular leprosy, mainly the severe pain is seen, the muscle weakness is seen, skin skin stiffness and the dryness is seen, loss of fingers and toes, eye problems, blindness, and enlarged nerves. These are the symptoms or the diagnostic characteristics for the tubercular leprosy. In the lepromatous leprosy symptoms, we can see the thickened skin on the face, nasal stiffness, bloody nose, it means a nose which is bleeding, laryngitis, collapsing of nose, swelling of the lymph nodes in the groins and armpits, scarring of the testes that leads to the infertility, and enlargement of male breast. So these are the symptoms which are seen mainly in the leprosy. On these symptoms, we can divide the leprosy into different times, and we can diagnose that these are the symptoms of leprosy. Next thing, how does the leprosy spreads? Anyone knows? Let's see how the leprosy is spread. The bacterium Mycobacterium leprae causes the leprosy. It's thought that the leprosy spreads through the contact with the mucosal secretions of a person with the infection. So, mucosal secretion from the patient or the person is the main cause or is the reason for the spreading of the leprosy. This is usually occur when a person with a leprosy sneezes or cough. So, by the coughing and sneezing of the infected person, the leprosy is spreaded. The disease isn't highly contagious. However, close and repeated contact with an untreated person for a longer period of the time can lead to the contracting leprosy or contacting leprosy. So, this leprosy is not highly contagious, but repeated contact, or we can say the immediate contact with the person or the wounds will easily or has the high chances for spreading the leprosy, which are untreated wounds. Remember, these are the untreated wounds or unnoticed wounds which are uh, in which where the contact with the person in an immediate way will spread the leprosy. The the bacterium responsible for the leprosy multiplies very slowly. The disease has an average incubation period. Incubation period means the time between the infection and the appearance of the first symptoms. So, the incubation period of Mycobacterium leprae is of 5 years according to the World Health Organization. So, according to the WHO, it is said that the incubation period of the bacteria is almost 5 years or more than 5 years, where the symptoms are seen very lately in the infected person. So, what is the prevention? So, this is the contagious disease. So, prevention should be taken for this thing, and the simple preventions are those which can be done in a very simple way. That first is the separate patients and young children in the family. So basically, the separations, that is, we can say that isolation is done for the patients from the family members and the young childrens. In the young, see, the next point is chemotherapy of patients and family BCG vaccination. So in the patient, we can do the chemotherapies and the family can get vaccinated for the BCG vaccine. So the immune system of the family members will improve. Another thing is avoiding physical contact with untreated people. Avoiding physical contact means direct contact with the person, skins, or the wounds which are untreated. The another thing is people who are in the immediate contact with the leprosy patient should be tested for the leprosy. So this is the prevention. This is said as prevention because when the people which are in the direct contact or the immediate contact with the patient uh, may get infected, and if they get infected they will a simple testing and simple testing can be done if they found as a positive person, or they found they get infected, or they found as an infected person. The initial stage of treatment can prevent the disease which becomes severe or becomes as an proper disease. So this is the thing that after testing these people, the prevention, the initial treatment can be given and the disease can be prevented. So another thing is annual examinations. Annual examinations are done. This could be of the family members, or we can say simply as a society, which are annual examinations are done. There are different schemes by the government. We will see it in a further slides. So next we will go for the another thing. So we will go to the types of the leprosy. There are many types of the leprosy. This leprosy is classified. There are three systems for the classification of leprosy. First is tubercular leprosy versus lepromatous leprosy versus borderline leprosy. This is based on the person's immune response. So this is the one system which classifies the leprosy according to the immune response. Another thing is WHO categorized the disease based on the type and number of the infected skin areas. According to WHO, the number of lesions or the number of affected skin areas will classify the leprosy. And the last classification is based on Ridley Joplin classification, which is based on the sign and symptoms of the leprosy. So tubercular leprosy versus lepromatous leprosy versus borderline leprosy. See, these are the leprosies which are having slight differences or major differences, and these are based on the person's immune response to the disease, which determines the types of leprosy they have. So in tubercular leprosy, the immune response is good. So immune response is good means a person with this type of infections only exhibit few lesions. The disease is mild and only mildly contagious. So if the person has the good immune system or immune system response, the person who after getting affected also will cure itself or cure it by himself, or the immune system will cure the wounds or the lesions. So in this type the person will show the good response, and they will not need they will not need the treatment at the initial stage which are very severe. So this is the good response shown by the immune system, and this is called as the tubercular leprosy. So this disease is In the tubercular leprosy, you can see the few lesions means up to 1, 2, 3, 4, 5. Few means which is countable kind of thing. So this tubercular leprosy will have the few lesions, and they are mild and mildly contagious. Next thing is, in lepromatous leprosy, the immune response is poor. So the immune response is poor means the person which is infected has to be treated and cannot cure or cannot heal the wounds or the lesions by itself. So this type also affects the skin, nerves, and the other organs. There are widespread lesions means on the larger area of the skin the lesions are seen, including the nodules. Nodules are nothing but the large lumps and the bumps. These forms of disease is more contagious. This is a contagious disease. So with the direct contact with the person, the lepromatous leprosy will spread in a higher amount, or we can say in a high quantity. So the last thing is, in borderline leprosy, there are clinical features of both tubercular and lepromatous leprosy. So clinical features mean nothing but the sign and symptoms which are from the both tuberculoid and the lepromatous leprosy. So that's why that is called as a borderline leprosy. In this leprosy, it is considered in between the two of lepromatous and borderline tuberculoid and lepromatous leprosy. See, we will go to the World Health Organization classification. In this classification, we can see the WHO classifies the system on the basis of the lesions. So the first category is Paubacillary Mycobacterium leprosy. So in this there are 5 or fewer lesions and no bacteria is detected in the skin samples. See, you cannot get any sample of bacteria in the skin, but you can see the lesions on the skins. It could be 1, 2 or up to 5. In the second category, which is multibacillary, multi itself says that multiple lesions or more than 5 lesions are seen in the multibacillary leprosy. The the bacterium is detected in the skin smear or both. Means in the skin smear and on the samples, slit samples, and on the lesion, the bacterium is seen. So, according to World Health Organization, this is divided in the two type, that is PN, Paubacillary, and Paucibacillaries, and another is multibacillaries. This is the last classification we can see, Ridley-Joplin classification. So you can see the classification is based on the symptoms and the disease response. There are 5 classes we can see. The first is tubercular leprosy, in which the different symptoms are given. See, a few flat lesions. Flat means they are not having any swelling or bumps, or neither the hollow lesions are seen. The flat lesions which are seen on the skin, some are large and numb. Numb means where the nerve endings are not working, and those are having numbness. Some nerve involvement is seen in the tubercular leprosy. The main characteristics of tubercular leprosy is shiny, hypopigmented lesions. So, uh, in the images we have seen, the person on his back there are hypopigmented means whitish, or we can say a discoloration of skin is seen, and those lesions are shiny in the nature. So this is the ideal, or we can say the characteristics symptom of the tuberculoid leprosy. This disease shows the response which can heal on itself, or it can persist or it may progress to a more severe form. Are you people getting what I'm trying to explain?
Yes, ma'am.
Okay. So in the tubercular leprosy, the main thing is that the lesions are flat. There is only numbness in the lesions, and these lesions are hypopigmented, means discolorated skin or demyelination of the skin is occurred, and these lesions or that the skin part is shiny. You can see the shine on the skin. So this is the ideal characteristics of tubercular leprosy. Another is borderline tubercular leprosy, where the lesions are similar to the tuberculoid but more numerous. The large number of lesions, just like a tubercular leprosies, are seen. The more nerve involvement is seen in the borderline tuberculoid leprosy. See, I have written that satellite lesion. In the satellite lesion, we says uh, um, satellite lesions means a thing which is outside the main thing. So, in this borderline, the large the large lesions are seen, and near to these large lesions, there are small lesions which are called as a satellite lesions, or this is the ideal characteristics for the borderline tuberculoid leprosy. See, just like Sri Lanka is the outside the India, or near to the India, and on the map we can see Sri Lanka as a very small part. So these are the satellite kind of things we can see on the uh, satellite kind of lesions, which are the characteristics of borderline tuberculoid. These are also known as geographical lesions. So, in this borderline tuberculoid leprosy, this leprosy may persist, revert to tuberculoid, means this can regress. Regress means the I can say treatment can reverse the borderline tuberculoid leprosy to the tuberculoid leprosy, or it may get advanced, or may get process. It may progress the disease. So tuberculoid these are the sign and symptoms and the response of the borderline tuberculoid leprosy. The another classification, or we can say another class of the leprosy, is mid borderline leprosy. In mid borderline leprosy, you can see the reddish plaques, moderate numbness, swollen lymph nodes, and more nerve involvement. So, and the last thing is punch out lesions. Uh, See, this is punch out lesion is the characteristics, or we can say the uh, feature of the mid borderline leprosy, where a part of a lesion looks like an punched out or taken out, or which is punched, which is taken out like a um, from the circle. You can feel that some of the part is taken out, and it has some depth kind of thing, so that why the lesion is called as an punch out lesion. So in the borderline leprosy, you can mainly see in the punch out type of lesions. So this also can regress, persist, or progress to the another forms of leprosy. The another class is borderline lepromatous leprosy. See, first is borderline tuberculoid, and this is another is borderline lepromatous leprosy. So, according to the lesions, these are mainly divided. So, in the borderline lepromatous leprosy, many small size lesions are seen. See, in the first, you can see the lesions, but these are many lesions which are small in size, and including the flat lesions. Flat means they are not having any bump or the swelling on them. So, or it could be the raised bumps, plaques, and the nodules having the numbness, which includes the more numbness on the lesions or the skin. This may persist, progress, or regress. The another type is lepromatous leprosy, where small size many lesions with bacteria are seen. See in this class, on the skin the bacteria is seen, not only the skin or the blood, but on the lesions we can see the bacteria availability, or we can say the presence of bacteria. The In the lepromatous leprosy, hair loss is seen, more severe nerve involvement with the peripheral nerve thickening, limb weakness occurs, and disfigurement. Disfigurement means loss of extremities like hands, fingers, and toes occurs in the lepromatous leprosy. So, amongst all those leprosy types, we can say that lepromatous leprosy is the severe type of leprosy where the disfigurements occur, and it is said that this lepromatous leprosy bacteria has the character or feature which moves to the cooler part of the area, and this lepromatous leprosy is seen on the face, neck, hairline, eyebrows mainly. So these are the things in the lepromatous leprosy. So how does the leprosy diagnosis is done? In the leprosy, a skin biopsy is commonly used to the diagnose leprosy. A skin biopsy involves the removing a small section of a skin for laboratory testing. So, in the biopsy, the small section of a skin is taken and the checking of the skin is done. And another thing, if you have the symptoms of the leprosy, a lepromin skin test may be ordered along with the biopsy to confirm both the presence and the types of leprosy. So, in the lepromin skin means apart from the skin, which could be the section from the uh, that lesions. It's taken and it is tested for the presence of bacteria, and which can also give you the type of leprosy. So this is the diagnosis for the leprosy. For the leprosy, another thing is done, that is the blood test. You can see how leprosy is detected. Just a minute. Okay, blood test is given in the further slides. So according to how leprosy is detected as early as per WHO. So according to WHO, the definite loss of sensation in a pale, that is hypopigmented or reddish skin patch, is the sign or symptom for the leprosy. The another thing is thickened or enlarged peripheral nerve with a loss of sensation and the weakness of the muscles supplied by that nerve. So thick, thick and enlarged nerves with a loss of sensation, that is the numbness of the muscles and the skin area, is another point for the diagnosis according to the WHO. The presence of acid fast bacilla in a slit skin smear. So the acid the slit skin smear is taken, that is the skin is tested according to the WHO, and where presence of the acid fast bacilli will confirm, or we can say will give you the chances for the leprosy contamination, or we can say leprosy infection. So the blood test is given for the leprosy. So phenolic glycolipid 1, this is the specific serological test based on the detection of antibodies to the phenolic glycolipids. This test yields a sensitivity of 95% for the detection of lepromatous leprosy, but only 30% for tuberculoid leprosy. See, it is said that the 90% chances, or we can say in the lepromatous leprosy, it is useful in a 95% in the for the detection, but in the tuberculoid leprosy, this test is only useful for the 30%. So another people which are infected by the tuberculoid leprosy, or which are we can say undetectable leprosy, which is just occurs in the pale skin or cannot be seen and seen in early stages. The biopsy and the skin test are used rather than this blood test. See, we will move to the global leprosy strategy further. So these were the things for the diagnosis and prevention and cause of leprosy. We will move towards the global leprosy strategies now. See, in 2016, WHO launched the Global Leprosy Strategy 2016 to 2020 and accelerating towards a leprosy-free world. So, worldwide, the efforts are done or efforts are taken to eliminate the leprosy. In 2017, WHO revised the case definition of PB and MB leprosy through the release of monitoring and the evaluation guide to the global strategy as follows. So the change definitions for the PB and MB are given are as follows. So we can see in the first case of PB, a case of leprosy with a 1 to 5 skin lesions without demonstrated presence of bacilli in a skin smear. So here we can say now the definition says that 1 to 5 skin lesions without presence of bacilli in a skin is also is said as a paucibacillary leprosy. Next, the multibacillary case. A case of leprosy with more than 5 skin lesions or with the nerve involvement, that is pure neuritis, or any number of skin lesions and neuritis. So where numbers of lesions can be varied and the nerve involvement is considered, or the demonstrated presence of bacilli in a slit skin smear irrespective of the number of the skin lesions, where if the presence of bacilli is seen in the skin smear, it is said as multibacillary case, irrespective of its number of lesions. It could be up to 5 or more than 5. So the next slide we will see. You can see the National Leprosy Eradication Programme, that NLEP. So in India, the National Leprosy Control Programme was launched by the government of India in 1955. Afterwards, the introduction of multi-drug therapy is done in 1982. The programme was converted into the National Leprosy Eradication Programme, that is NLEP, in the year of 1983 with the objective of achieving eradication of this disease from the country. So um now also the social workers and the government is working for this eradication of leprosy from India, because it is said that half of the world population which is infected by this leprosy is present in India. So India contains half of the leprosy cases worldwide. So government is taking steps for eradication or elimination of this leprosy from the nation. Till 31st March 2018, 29 states or UTs had attended the level of leprosy elimination, that is prevalence rate of less than one case of leprosy per 10,000 population, and 572 districts, that is 81.13% out of the total 705 districts also achieved the elimination levels. Another thing is ashas. Ashas are said, it is said that ASHA, accelerated social health activities, are helping in the case detection and to assure the complete treatment to community level. For that they are being paid and incentives. So some people are which are social workers, usually some of them are called as ashas, are paid for this thing, which are taking care of the people which are or the patient which are infected with the leprosy. They are looking after those peoples and taking care of their complete uh, treatment or drug therapy or regimens. So we will see the treatment for the leprosy. What is the treatment of the leprosy nowadays and earlier? Earlier diagnosis and complete treatment with the multi-drug therapy remains the key strategy for reducing the disease burden of leprosy. So the main and the basic thing in the leprosy treatment is the MTD. For that, MTD only works or MTD will work only if the early diagnosis is done and the complete treatment is taken. The treatment cannot be stopped in between the period. So, in addition, BCG vaccine is an effective tool for prevention of leprosy. So, BCG vaccination is done, which could improve the immune response in the people. So, BCG vaccination is done. The standard MTD regimen for PB, that is 2 drug, and MB 3 drug leprosy were introduced in 1982 with the duration of treatment of 6 months for PB leprosy and from initially minimum 24 months, and in 1988 it reduced to 12 months for multibacillary. So initially there were 24 month treatment for the multibacillary, which is reduced to 12 months in 1998. So upon the recommendation by WHO experts committee. So according to this WHO, the 24-month therapy is reduced to 12-month therapy in multibacillaries. The another thing is the MTT is provided in a blister pack. Everyone know the blister packaging. So MTT is provided in the blister pack, each containing the 4-week treatment. Every pack has a 4-week treatment, like a monthly treatment. Specific blister packs are available for multibacillary and PB leprosy with the different doses for the adults and children as shown in the next slide. So we can see these are the dosage forms given for the adults and children's. The standard adult treatment regimen for MB leprosy is rifampicin. Rifampicin is given 600 milligram once a month, and clofazimine 300 milligram once a month. The 50 milligram daily tapsone is given and 100 milligram daily duration daily. Duration is 12 months, where 12 blister packs of 28 days each. So these are given by the government or in a private, but this is the first line treatment given for the multibacillary leprosy. So you can see the dosage and duration of the drug. The standard adult treatment regimen for PB leprosy is rifampicin 600 milligram once a month, dapsone 100 milligram daily, and the duration of treatment is 6 months. So 6 blister pack is given for PB, and the dose is for 28 days. So this is the standard adult treatment for MB and PB. So standard child ages from 10 to 14 years treatment regimen is given for multibacillary. So rifampicin in the child is given as 450 milligram once a month. Clofazimine is 150 milligram once a month and 50 milligram every other day. Dapsone is given. The duration is 12 months, so 12 blister packs are used in a child. The standard child dose in the age of 10 to 14 for the PB leprosy is given as rifampicin 450 milligram and the dapsone is given as 50 milligram for the 6 months where clofazimine is not used in the PB treatment. Next is mechanism of action of rifampicin. So we will see how the rifampicin acts. The rifampicin binds to the bacterial DNA dependent RNA polymerase enzyme. So it binds to the bacterial DNA which is dependent RNA polymerase enzyme. Further, it inhibits the RNA synthesis which is mRNA, rRNA and tRNA. This, if the drug binds to the RNA or enzymes, it inhibits the RNA synthesis, and if RNA synthesis is inhibited, the proteins are not synthesized in the cell, and the no growth and multiplication of bacteria will occur. So, in this way, the rifampicin acts as an bacteriostatic where it inhibits the RNA and protein synthesis, which leads to the protein synthesis in the bacterial cell. The drug resistant. So, after taking a long treatment, patients get resistant to the drug. So, patients who start the MTD and are found to have the resistance to rifampicin alone or in association with the resistance to dapsone shall restart a full course of second line treatment regardless of clinical outcomes with MTD. So, whatever are the outcomes from the MTD, that is multi-drug therapy, multiple drug therapy in the first line drug, it means progression, regression, or any disease change, but having the resistance to the rifampicin or rifampicin with the dapsone or other drug have have to be given the second line drug treatment from the initial or from the complete treatment or the from the start. The second line drugs are given. So these are the second line drug. So in the first 6 months, rifampicin resistance, the person with an rifampicin resistance will be given as ofloxacin 500 milligram plus minocycline 100 milligram plus clofazimine, sorry, clofazimine 50 milligram. For the first 6 months, this dose is given as a daily dose, or you can say another alternative is given for ofloxacin 500 milligram plus clarithromycin 500 milligram and clofazimine 50 milligram. For this treatment, further treatment is given after the 18 months. We can say ofloxacin 400 milligram, minocycline 100 milligram, and clofazimine 50 milligram. And in the second alternative, we can see clof clofloxacin 400 milligram and clofazimine 50 milligram, where the clarithromycin is eliminated from the treatment. Sorry. And in the resistance type, which is person where the patient is resistant to the rifampicin and ofloxacin, the another alternatives are given like clarithromycin 500 milligram plus minocycline 100 milligram and clofazimine 50 milligram in a first 6 months, which is given daily, and for the next 18 months the daily treatment is continued as same as the previous. See, the note is given here, the ofloxacin 400 400 milligram can be replaced by levofloxacin 500 milligram or moxifloxacin 400 milligram, where the patients are resistant to the rifampicin or rifampicin plus ofloxacin resistance. So this is the second line treatment where the MTD will not work. Uh, are you people getting what I'm trying to teach you? Anyone? Am I audible to you?
Yes, ma'am.
Okay. So there are some myths in the we can say there are some myths for the leprosy. So first myth is leprosy is not a problem any longer. So people nowadays think that leprosy is not the problem. But the fact is, every year a significant number of people get affected by leprosy. The misconception associated with the condition prevents them from coming forward and talking about it. This leads to the delayed diagnosis and the treatment. Notably, leprosy is one of the major cause of disability in the world. So if you think with the advancement of medical science, leprosy has become a minor problem, you are highly mistaken. So this is the thing, people are not talking about it. Uh, we can say we have seen that, or we know that leprosy has a stigma and discrimination in our society. So people are afraid of talking about it, and they are shy of showing their problem to the people, their doctors. So this is going to delay the diagnosis and treatment, which can worsen the disease condition. And this is the thing. So in India, we can say it is said that India has the half of the population of leprosy patient worldwide. So India contains the 50% of patients from the world. So if we think, or if anyone thinks that leprosy is no more problem in the India or in the worldwide, they are mistaken. So nowadays also there are many cases in the leprosy. Myth 2 is that leprosy cannot be treated. So there are people who thinks once they are affected with the leprosy, they are not going to get cured. But this is the myth. The fact is leprosy is curable. There are severe antibiotics available to treat the infections. It was in the year 1995 the World Health Organization developed the multi-drug therapy to treat all the types of leprosy. Certain strong antibiotics can potentially kill the bacteria and prevent the occurrence of associated complications including hair loss, disfigurement, disabilities, blindness, infertility, and kidney failure, etc. etc. So, the another thing people thinks once they are affected, they are not going to get cured, but this is the myth. Nowadays, there are many drugs, or we can say antibiotics, which are going to cure, which is going to revert the leprosy, and which is going to help in the prevention in the hair loss, or going to cure the sign and symptoms of the leprosy. We will go further and we will see the myth 3. The myth 3 is only old people are affected by leprosy. The people thinks that the elder peoples will get affected by leprosy only. So this is not the thing. The fact is leprosy is not age specific. It can affect anyone that any point in time. People probably believe in the misconceptions because of the long incubation period of leprosy causing bacteria and extremely delayed visible signs and symptoms. So we have seen that the Mycobacterium leprae has the incubation period of more than 5 years. So there are cases in which the person got affected by the infection during the adulthood or the childhood and got visible signs when they became old. So this is the thing, due to the incubation period where the bacteria grows slowly in the body, so the sign and symptoms are seen lately. That's why people has that misconception that the leprosy is only seen in the elderly peoples. So leprosy can occur in the children's also, but the sign and symptoms are seen lately. That's why this is the thing that leprosy is uh, occurring in every age group. So we are finished with this webinar. Um, does anyone has any question? Students, is there any
Yes,
query?
ma'am. We have a question from our students that what happens when the woman is pregnant
Okay.
and she have leprosy?
Okay. The woman having a leprosy will not affect any the child will not get affected, or we can say the newborn will not get affected with this leprosy. The pregnant woman can deliver a child which is healthy and can live their life like a normal newborn baby. They are not going to get affected in the pregnancy. It is not contagious.
Okay, ma'am.
See, someone is asking that how many months it takes to cure the leprosy. So we have seen that the duration of leprosy treatment, see, we will go to the slide. It's from 6 to 12 months. We have taken it in the slides that it takes usually 6 to 12 months of duration for the drug treatment, and if the drug resistance occurs and the a person will not show response to the MTD, the further treatment is given with the second line drugs, and it may take another few months or years to cure it, but the leprosy is curable only if it is cured within a time or the diagnosis is done earlier. If the disfigurement or people starts losing their extremities, this cannot get reversed, but they can be treated. See here it is given that, see, you can see on this slide with multivascular NAPB, the treatment for the 6 months and the 12, initially for the PB there was an for MB there was a treatment of 24 months which is reduced to 12 months. This is the uh, time period for the curation of leprosy. Is leprosy is contagious? Bharvi Keni. No, leprosy is not highly contagious. Actually, it is a contagious thing or a disease, but it is only contagious if the person is in a direct contact or a continuous contact with the patient. Uh, so that there are chances for the spreading of leprosy, but as such, it is not an contagious. You can stay around the people or the family members which are affected by the leprosy, but it is better to prevent or take care of the spreading of the, or we can say we can take the prevention for avoid the spreading of the leprosy. Anyone?
Yeah, ma'am, there is another question that is there any other method to cure leprosy rather than drug therapy?
I think prevention is the only thing which can be used for the prevention or the curation of the leprosy. If the person is infected, antibiotic is the only treatment which is given to the we can say to the patients.
Okay, ma'am.
Someone asked me question, I think here. How is leprosy transmitted? Yes, we have seen that leprosy is transmitted through the mucosal secretions like sneezing and coughing. Hmm? Akshata Shelke has asked that can other people get leprosy from the patients? Yes, it is a contagious, but it is only occurring in the patient or with the people which are in the direct contact with the lesions. Are you getting?
Yes, ma'am.
Okay.
Uh, any student having any questions can ask.
I think we are done with.
Yes, yeah, ma'am. There is no. I think no one should ask. So thank you, ma'am. Now I will like
Okay.
to call our GS, Mr. Gaurav Naik, for the felicitation program.
Uh, so hello everyone. Ma'am, I want to share the screen. Can you stop sharing?
Okay, okay, I will stop casting.
So hello everyone. Firstly, I would like to express my gratitude to our ma'am, Miss Gauri Bhamre. We are very
Okay.
indeed lucky to have an experienced teacher like you. Thank you, ma'am, for taking out your valuable time and for this webinar. And it was very informative. We are very grateful for your guidance on the occasion of World Leprosy Day. We would like to give you a small token of appreciation on behalf of SSJ Corp. Thank you, everyone. Thank you, ma'am.
Thank you, Gaurav, and other students and the committee members. I'm very thankful for this token of appreciation. Uh, See, this was my first experience, and the online things are the different things which are seen, but I'm very happy to see this token of appreciation online also. And so I'm also thankful for you, all the students and committee members, for giving me this beautiful opportunity. Thank you.
Thank you, ma'am. Thank you so
Yes,
much.
ma'am. Thank you very much.
on kar Gaurav.